I said yesterday that we are facing our biggest challenge to date and that we can and we must rise to the challenge, and that is exactly and precisely what South Australia has done. We had more than 5,000 people who were tested yesterday. I'm now advised that today we are on track for more than 6,000. This is nothing short of sensational and will be a record for South Australia. So my heartfelt thanks to every single South Australian who's heeded the calls to go out and get themselves tested, and we're very, very grateful for that. I'll soon pass over to Professor Nicola Spurrier for the daily update. But before that, I need to reiterate to the people of South Australia that we are not out of the woods yet. We are just at the beginning stages of dealing with this particular very nasty cluster in Parafield. We are going to get through this, but we're going to get through it with the cooperation of every single South Australian citizen. Everybody must play their role in making sure that we stop this disease in its tracks. It is very, very important to do that. We have beaten clusters before, the Barossa cluster, the Adelaide Airport cluster, the Thebarton College cluster, and we will beat the cluster at Parafield, but we must do it together, working together, listening to the restrictions, and again, getting ourselves tested as and when we need to. I'm now going to pass over to Professor Nicola Spurrier.
Thank you and good afternoon. Well, unfortunately, we have some more cases to report today. And for today, we have 5 new cases. 4 of these are linked to the Parafield cluster. One of the cases, I've only just received the result and they're now being interviewed. So I'll have further details about that case once we have them to hand, and that will be most likely reported through tomorrow. In terms of the other new cases, we've got one case that is associated with the aged care facility, the Anglicare aged care facility, and it's one of the workers there, and that person is now in quarantine in a Medi hotel. The other 3 cases are family members of one of the security guards who is associated with the Medi hotel. Because of that, in fact, we've had to give information to the Roma Mitchell school to close down until further notice. So the ages of the new cases range from somebody in their teens through to someone in their 50s. And importantly for South Australians, all of these people have either no symptoms or they are very mildly symptomatic, and they've been picked up early in the course of the disease. The other thing I'd like to tell people about, and some further results that we have about the Parafield cluster, is that we now have the genomics information back. So that's the testing of the genetic material of this virus, of this strain. And we've been able to link, we did the testing because it was the first case, you'll recall, was the older woman in her 80s. We've tested her strain and we've linked it to somebody in the Medi hotel where her daughter worked. And the person who was the traveller arrived in South Australia on the 2nd of November and was tested on the 3rd of November. So prior to the 2nd of November, we did not have COVID in the state, but that's when it was introduced, this particular strain. So in addition or just as a summary up until midday today, in terms of the numbers, we've got a total of 20 cases now linked to this cluster. But in addition to that, we have another 14 people who we are suspecting may be cases, and we are still doing testing to confirm that. But these are people that we feel are at high risk of becoming a case and have symptoms, and we're just waiting for that testing to come through. But because we want to be very, very precautionary and really work very quickly, that is the reason why we are calling them suspect cases, and we've put public health into action to make sure that we can contain it. So those people are either awaiting a test result or we have an initial test result that's negative, but we're highly suspect and we're retesting them. And the reason we're doing this, obviously, is because of this very high risk of onward transmission in our community. So around, I was asked yesterday, how many of these close contacts are in quarantine? We've now got around 4,000 people who are close contacts who are quarantined. and these people have been advised to quarantine, and they're being contacted on a daily basis for a symptom check. So this is a huge amount of work, as you can imagine, to make sure that we are in regular contact with these people. So in terms of school closures, we now have 5 schools, and there's the Roma Mitchell College that I mentioned, and that's in addition to Mawson Lakes Primary School Preschool Complex, Thomas More College and the Holy Family Catholic School that I mentioned yesterday. And there's also Mount Carmel College. That may be able to be released, but we again being very precautionary in this instance. So some closures may be longer than others, and it really depends once we start to get the interviews through and get more information, and then we'll make a determination. But we've decided to take a very, very cautious approach and just get on and have people go into quarantine. So parents, you need to look at the website, at the Education Department website, and also, of course, your own school's website to get an update of what this will mean for you. The other thing is we have some updated advice. So updated advice for all South Australians who visited the Aquadome in Elizabeth. So this is much more specific advice. Anyone at the Aquadome between 11 a.m. and 1:30 p.m. on Saturday, so last Saturday, the 14th of November, we now want you to quarantine for 14 days and get tested immediately. So we think that the exposure was more significant, and we want those people to get into quarantine immediately and get tested. Now, obviously, we'll be chasing up with the Aquadome to see if we can get direct contact details, but this is an early warning to those people. Anybody that was there with their family and children on Saturday between those times, get yourselves into quarantine until further notice and get tested. So in summary, in terms of active cases, there are now 34 active cases in South Australia. This brings our total to 549, with 511 recovered. As the Premier indicated, South Australians have heeded the need to get tested, but get tested with symptoms, please. I know that I've stressed that many of the actual cases have had very mild, if no symptoms, but we do need to prioritise our testing across South Australia. And I know that many of you would have been a little frustrated with the wait at our testing stations today, and I do thank you for your patience. But we're particularly wanting South Australians who are symptomatic. There are other people who we've actually directed to have testing, and in many instances we've set up specific pop-ups and particular testing arrangements for them. So there were more than, there's been now more than 595,000 tests for COVID since February. I really want to stress this is early days in this cluster. And whilst we had that large number over the weekend, we have, a significant number of new cases today. Importantly, they have all linked back to this, the genomics and also with the interviewing to this Medi Hotel, but there is one case today that I cannot give you any further information about because they are still being interviewed. Please heed the fact that we need to be more restricted now in South Australia. We have put some legal directions in place to have certain high-risk activities closed down, but every single one of us need to start thinking about, do we need to go out, do we need to do that activity, and make some sensible choices about that. People who have chronic health conditions, who are in an older age category, I urge you to stay home as much as you possibly can at the moment and get your family or other support people to do your grocery shopping and such like for you. Now, I know it's very disappointing to have to do that, but we really do want to stop the number of contacts that people are having between each other. And so, as the Premier said, we do have these new restrictions in place, and these have to be adhered to. Thank you to all the South Australians that have listened to this advice. I agree with the Premier. If we all work together, we will get on top of it, but it is certainly early days. The other thing I would just like to say is because we've had now cases in the Peppers Hotel, which is the Medi Hotel to which this is linked. There are a significant number of people who have travelled from overseas and have done their quarantine there and are nearing the end of their quarantine time and expecting to be released and to travel back interstate to get on with their lives here in Australia. But unfortunately, we are still working through whether it is safe for them to do so, because obviously they are now in a hotel where we've had some active cases with the staff. I absolutely sympathise and understand your frustration, but in terms of our public safety, not just for South Australia, but the whole of Australia, I urge you to be patient and please, we will try and inform you absolutely as the time passes as to your situation. And we have a significant number of GPs and other health staff who are working individually with these people. I just also wanted to let people know that we are working very, very rapidly and a real focus on getting more SA pathology staff, and I know ClinPath and ACL are also trying to do as much testing as possible. I know that the waiting time for the COVID screening clinics can be quite long, but we are trying to get additional staff in place and working to have them open for longer periods of time. And at the moment, they're running from 8 in the morning till 8 at night. So very happy to take questions.
Professor, can you understand that people in the Peppers Hotel that have been relocated and have done their quarantine, there could be rapidly emerging mental health issues here?
Yes, I absolutely sympathise with them, particularly, they've been doing their 14 days and to be, told this. But we have to weigh that up with the risk of this disease getting out further in our community. And also, as I said, we have a national responsibility because many of these people, in fact, perhaps the majority of these people will be travelling interstate on our domestic air flights. And as many people know, in fact, other states have put quarantine and entry restrictions on people travelling out of South Australia.
Professor, that you're monitoring, are any of them medical staff from their own field?
I don't have the details, I'm sorry, but certainly we are being extremely cautious and making sure that even suspect cases are put into quarantine until we're absolutely sure that they're cleared.
So, Professor, overnight today we've had 5 and you've got 14 under investigation. Do you expect, in your medical opinion, that we are going to get a significant rise in the next 24 hours in our case numbers linked to the parafill cluster?
Look, I just think it's too early to tell. I know that we're in the early days of this infection because the people who have tested positive when we've checked their serology, which is the blood test, which looks at the antibody response or the immune response to the disease, show that it's very early in the course of their infection. So it's really just too early to tell. But what all South Australians can do is to be patient when they go to get tested with symptoms, but also try and reduce your contacts.
Can I just clarify? Sorry, can I just clarify? The 14, is any of them community transmission, or are they all close contacts of the existing case?
Yeah, these are all close contacts. So these are people who are particularly younger children who have tested negative but may have symptoms and have a parent that's positive. So again, we're being extra cautious.
Professor, on the list of affected locations, there were 2 of the Medi hotels. Is there a staff member that was working across multiple sites?
So 2 of the hotels are linked because, they're part of the same business. And my understanding is that there had been some crossover of staff, and that's why we've listed the 2 sites. But my understanding is that one of those hotels actually didn't have any patrons.
And it was a recommendation from the investigation in Victoria that staff not be allowed to work across multiple sites when it comes to Medi hotels. Is that something that South Australia was aware of, or would you be implementing any new rules surrounding the multi-site work?
Well, like I said, one of the hotels, as I understand, didn't have any patrons at the time, so whether or not it was that the staff member had gone across to the building, but we've certainly, from a contact tracing interview perspective, have listed those times as potentially infectious.
So you seem to have said that of the 5 new cases, some were asymptomatic.
Mm-hmm.
Is that now an emerging problem, that we might have dozens, if not hundreds, that are in the same boat, and they just don't know to get tested because they're not feeling unwell?
Well, it is a very, very tricky disease. I mean, this coronavirus, novel coronavirus, it's very sneaky. And it's also, some people may think, oh, it's just hay fever, I just got a bit of a runny nose. So it's also a bit dependent on people being rather cautious about when they're feeling unwell, and some people are more stoic than others. And of course, when you're being interviewed, it's sometimes difficult to remember, particularly if it's quite mild symptoms. So I feel somewhat surprised that we've got so many people infected, but with such little symptoms. It may also be because they're in the early stages of the disease, and may in fact get more symptoms as time progresses.
But surely that's a concern, isn't it? That if it worries you, it must be worrying to the whole of South Australia.
Yeah, this is a very, very worrying situation. I'm not going to underestimate the concern that I've got about this, which is exactly why we put some restrictions in place here in our community.
Professor, in August, your colleague, Mike Cusack, said that we were going to be undertaking tests on security guards and other staff at the hotel. He said it would initially start with between 80 and 100 tests. Did we do that? And if not, why not? Yeah, so we have had availability of testing in our Medi hotels for quite some period of time, but the issue is whether we've mandated it or not. And we have had it as a voluntary, as have other states. What we have been talking about at AHPPC, and I've strongly recommended, is that testing is done in every Medi hotel across the country every 7 days, and we've brought that policy in now.
Professor, continuing today's golf, Professor, what's your latest guidance on the wearing of masks amongst the South Australian community?
I am going to start more strongly recommending that people wear masks in our state. We gave advice yesterday that if you can't maintain your 1.5 metres distancing, you should be wearing a mask, and that might be on public transport, but it might also be in crowded rooms.
Professor, the update on the patients, are they all in stable conditions?
Yes, fortunately, everybody's remained in a stable condition.
In terms of to clear the backlog, we're talking hours and hours and hours of wait time. Are you receptive, or are you investigating around-the-clock testing, 24-hour testing? And secondly, are you concerned that you are going to lose the public's trust in getting tested because people are not wanting to line up for 8, 9, 10, 12 hours to get a 15-minute test when it's so important and critical? Yeah, this is the forefront of my mind today when I heard what the waiting time was, and we've got a team working on solving that. We know we've got the testing capability, i.e. the machinery to get it through. It's actually getting the test done on people. So we're looking at bringing on substantial additional staffing. I would love to have 24-hour testing, but we've also got to think about the safety of people, because after hours, obviously, there's more issues with security.
The 3 children you mentioned yesterday who you were expecting to be positive cases, what's their status today?
So they have come back with repeat negative PCRs, but we are not winding back the public health response, which was the quarantining of close contacts, because again, I am being extra cautious.
So all 3 are negative?
Yes.
The Federal Health Minister earlier today was encouraging people to get tests if they are asymptomatic. Seemed to be in contradiction to what you said yesterday. What is the advice for people who aren't seeing symptoms that aren't a part of this close contact?
I am wanting people with symptoms primarily to come forward and get tested. What I don't want is our public health system, our SA pathology and our private labs to get clogged with people who are the worried well. So for us in our state, our priority is anybody that has been asked by public health to get a test done, regardless of whether they're symptomatic or asymptomatic. The next group is anybody that has been to any of the locations listed and developed symptoms. You must get tested straight away. And then the last group is the whole of South Australia. If you have respiratory symptoms that fit with COVID, then please get tested.
Can I just clarify today's numbers? So there are 5 cases, one of which is not related to the cluster?
There's 5 cases, one of which I have only been told about in the last hour and is currently being interviewed, and I don't have any further information about that.
Yeah, with the
So
close-
these schools, there's a number of schools that have been closed. How many close or casual contacts are there within these schools? Are the students that have been forced into quarantine? Do you have any numbers on that?
I don't have the numbers of those. Again, we're trying to add up numbers, but that hasn't been my priority to get the number of students, but it's a significant number.
What is the risk within those schools that there has been an infection in terms of how long do these kids have been in these schools while positive?
It's probably in the scheme of things, in terms of all of my concerns, it's probably in the middle. My highest concern, obviously, is for the aged care facility and also the correctional facility.
Professor, can you just please give some clarification around dance studios? There's nothing in the legal directions that state that dance studios and dance schools should close. What is the legal direction on that, please?
I'll just pass over to the Police Commissioner, who will give you some more information about the restrictions.
Just in terms of dance studios, they'd be classified as indoor fitness activities, and if there is any ambiguity about that, then we can certainly change the direction to make sure that's abundantly clear. I think it comes down to the general principle of people assessing the type of activity that they are proposing to undertake and making sure it's consistent with the social distancing requirements and also the other restrictions that have been put in place. That's critically important for people to do that.
Commissioner, just on the restrictions, what sort of enforcement activities are police undertaking following the change over at midnight last night?
We are doing as we have done right throughout the course of the pandemic. We are prioritising our resources to make sure we visit those people who are of greatest risk to South Australia in terms of potentially passing on the coronavirus. We do have limited resources, so we can only prioritise those which are deemed most critical for our attention, and we will continue doing that. Once again, we have seen significant levels of compliance by people who are required to go into quarantine, and I must stress, for those people who are required to go into quarantine, it is important that they isolate within their own homes. They can't simply participate in normal family activities whilst they are quarantining. They must segregate from the rest of the house as much as possible, otherwise the whole purpose is pointless. The other thing I just wanted to mention quickly is that we have schoolies coming up at the end of this week, and people who are participating in travel to regional locations on pre-planned activities must remember that the number of people they can have in any residence is 10. If they're on a houseboat, they can only have 10 people. If they're on a caravan site, they can only have 10 people. If they're in a private gathering away from a premises, they can have up to 50, but there are strict conditions in relation to the sorts of activities that can be undertaken. We will be monitoring those areas where we know people are attending for schoolies, and we're also being supported by National Parks and Wildlife and other emergency services agencies. So we want people to go away, fulfil their obligations or their intentions to travel, but do so safely and be mindful of the risks that they may be exposing themselves to or their family and friends.
Commissioner, what are the transport arrangements for the close contact with people in this cluster when they have to go to a hotel? We've been told some of them have been told to catch a cab to the hotel. Is that right?
It certainly depends on the circumstances and the level of risk that we're advised of by health. Some people can travel under their own mechanism to quarantine. Others that we are collecting and supervising their travel to make sure that we mitigate that risk.
Is a taxi appropriate?
Depending on the circumstances, and that is advice which is given by health.
So it could be appropriate?
It could be appropriate, yes.
Commissioner, can I just ask you what is a public perception of double standards with the Medi Hotel and enforcement? Up until Sunday, you were not requiring Medi Hotel staff to get testing, yet you are enforcing fines on businesses who breach the directions. Is there a double standard with that at all?
No, I'm struggling to see a connection between one activity and the other, and I'll also stress that the number of fines that we've issued is incredibly low when you look at the total number of businesses we've visited. Once again, we've been providing education and support to businesses. We have given more second chances than I think people would appreciate, but we've seen a positive response from that, which is why we've continued down that path. I think people want to do the right thing. They are trying to do the right thing, and we're respecting that. But I'll also reiterate that if we do see blatant breaches of the directions or a complete disregard for advice given, we will take further action.
Have you raised any concerns with your national counterparts about some heavy-handed tactics of other enforcement on other borders and taking your educational approach. You know, we've got trains being turned back, we've got people being ripped off walking trails, we've got people being told to go into quarantine interstate. Has there been any discussions around the commissioners around the...
Not in the last 24 hours. The commissioners haven't met to discuss the current situation in South Australia. We are meeting regularly via Teams. What other jurisdictions do in relation to directions or restrictions within their own jurisdictions is entirely up to them. We have no capacity to really influence that. We have a consistent and measured response in South Australia, and we'll continue to do that.
As the state coordinator, what does the roadmap out of this look like for you?
Well, I think the first step is that we take the swift and decisive action that we've seen so far, so we know that we are doing as much as we can to contain this current cluster. If we're successful in that regard, then I'm hopeful that sooner than later we can restore the level of restrictions back to what they were prior to the weekend.
Is the goal still a fortnight or so, Commissioner, at this early stage?
Well, at this stage, it's too difficult to tell. I think, as Professor Spurrier has highlighted, we simply don't know exactly what we're dealing with at the moment. We are doing a huge amount of work to identify any possible infections. We will see where that takes us, and decisions about where we go from there will be based on what we find as we move forward. I think everybody, regardless of what role you play in this scenario or whether you're just a member of the community, everybody wants these restrictions to be lifted, but at the same time, we want to know that we're doing as much as we can to contain this virus.
Can I just confirm the interstate travel advice? Yesterday it was advised for people not to travel unnecessarily. So people are still being told it's okay to go to school leave?
Yes, absolutely. What we've said yesterday is unnecessary intrastate travel should be reconsidered, but if you have already got arrangements in place, or you need to visit family or friends, or you have some specific engagement that you are intending to complete, by all means do that. But we'd just ask people not to perhaps spontaneously jump in the car and start moving into the regions. There's no need for that, but people should be able to fulfil their standing obligations and look after family and friends that might live in regional locations.
Premier, thanks. Premier, question following Professor Spurrier saying there are 14 potential cases and add that to 20. Is it now, as night follows day, that the Test cricket here is looking extremely doubtful for next month?
I know we're still hopeful that the cricket will go ahead. What we're doing in South Australia is putting all of those people that we think pose the biggest risk, those people that have come into contact with somebody who's infectious, put them into quarantine as quickly as possible. We want to stop the spread of this disease in its tracks. We've got a great level of cooperation from the people of South Australia so far. When we've asked them to go into quarantine, they've done exactly and precisely that. When we've given them a direction to get tested, that's exactly what they've done. So high level of cooperation to date.
With greatest respect, that was the question I asked. Given the level and the increasing level, Cricket Australia are not going to be looking favourably upon Adelaide, where they can perhaps go to Sydney or Melbourne for the first test.
I think we're still a long way off, and we're very hopeful that we will get on top of this parafield cluster very, very quickly, and we're doing that in cooperation with the people of South Australia.
Spoken to Cricket Australia?
Not personally, no.
Has anyone made any attempt to find out where they're at?
Look, I can get an answer on that and come back to you.
Premier, speaking of interstate, what's your reaction now, a day on from the decisions that have been made by other jurisdictions to essentially close off from South Australia and enforce new quarantine periods?
Well, look, we respect the rights of all states to make their own decisions in the best interests of their state. Our obligation is to provide them with detailed data regarding the cases that we have here in South Australia. Ultimately, they need to make up their mind with regards to those border restrictions. Obviously, yesterday would have been a bit of a shock to many of the CHOs around Australia, with 17 cases reported. Some of them took immediate action. Some of them, of course, are waiting to see what is going to occur. We are working night and day, throwing every single resource we have at this problem, and we plan to stop this disease in its tracks.
What about hospitality businesses that have lost money in the last 24 hours? One restaurant down at Bowden has had more than 200 cancellations, and they seem to think they slip through the net in terms of government assistance. What do you say to them?
Well, look, what we're doing is trying to really act quickly and decisively against this disease so that we can minimise the damage. We can see exactly and precisely what happens when this disease gets away from a country or a city. We don't want that to occur in South Australia. So yes, we've gone in hard, we've gone in quickly. We want to get through this as quickly as possible and stand up our businesses, but we're only going to do that when it's safe to do so.
So there's no extra funding for them to get them out of what is an emerging new mix?
Well, look, the reality is what we need to do is to get those businesses back and operational as soon as possible, and that might mean some pain in the short term. We are very mindful of the impact that this has on all South Australians, but we're working together with them to get through this as quickly as we can.
Speaking of South Australians, many of South Australians appear to be engaged in panic buying once more. Have you got a message to those who seem to be clearing out supermarket shelves again?
Look, I won't be as direct as Jean-Paul Drake from Drake Supermarkets, but the reality is there is absolutely no need for panic buying in South Australia. We've got plenty of stocks. We've got open supply lines and transport lines here in South Australia. What we need is a sensible approach, working together to beat this disease, and I'm quite sure that's what's going to happen.
Premier, can I just ask you, we've seen scenes of chaos across the country with travel and as I raised with the Commissioner, with heavy-handedness. What is your, do you have a public comment about what is perceived to be a heavy-handed approach to South Australians interstate?
Look, I'm not familiar with what you're referring to. My focus is 100% on stopping this disease in its tracks. We're throwing every single resource we have at this, and we're doing it in cooperation with the people of South Australia.
Will you give Professor Spurrier resources for 24-hour testing?
We've always responded to the requests that SA Pathology and SA Health have put forward. We fully funded our response to this, and so when SA Pathology come forward, whether it's for standing up mobile clinics, whether it's clinics in the country, clinics in the city, or the drive-through clinics, they have been provided with that resource. We don't tell them where they should put those resources or where they should put those stand-up or pop-up centres, but my understanding is they are fully aware of some of the delays, as we've had a massive jump. Today will be a record in South Australia, and we're very grateful for that. We're also very grateful for the patience of the people of South Australia who have done the right thing. They've waited in line. They're doing it on behalf of all citizens in South Australia, and for that we're very grateful.
Earlier in Parliament you said that cleaner at Peppers caught the virus off a surface. Do we know more about that? Was that while they were cleaning a room? Or?
No, my understanding is that it is very likely that they did contract this disease through a surface transmission. We think that is the case, but obviously our number one priority at the moment is just working as quickly as we can to get on top of this disease. Every single case that we have has an investigation. This one, of course, will have a very special investigation because we do really want to get to the origins of this. Most of our transmissions in South Australia to date have been through aerosol droplets or physical contact. We are very concerned about surface transmission. We've read about this, we've seen it in other jurisdictions, but this is probably the first confirmed case that we've had in South Australia, but it's quite possible there have been other cases in the past, but we'll be looking very carefully at this particular case.
Can I just confirm the numbers? Sorry, but earlier Professor Spurrier said there were 20 links to the cluster. Yesterday it was 17. We got one report this morning of 1, and then the Federal Health Minister announced another 3. The numbers just don't seem to add up there. So is it 20?
Yeah, my understanding is that we had 17 which we reported yesterday, a further 1 this morning taking it to 18, and then there are the 3, if you like, family members of one of the security officers which would take that to 21, which is now in this cluster. I'm not sure whether that...
Yeah, so up until midday today there were a total of 20 cases, and then we've had one most recently referred
to 21.
Yeah,
all right, thank you very much.
Professor Spurrier, sorry, can I ask?
No time, sorry guys, we've got to get going.